Hello everybody, so let's do a couple of NCLEX practice questions. If you're new here, I'm the nursing student Avenger. I'm doing a lot of TikToks. At the same time, I'm starting this YouTube channel to do questions. So let's start with question number 1. So it's all NCLEX question related. So are you guys ready? Okay, so I have a timer here on my cell phone, and I'm gonna give you guys 15 seconds to answer the question. So the first question is: a 72-year-old male patient with a history of heart failure is admitted to the medical surgical unit after reporting a 5-pound weight gain over 2 days and severe difficulty breathing. Upon assessment, the nurse notes the patient is restless, has a respiratory rate of 30 per minute and an oxygen saturation of 87% on room air. Auscultation reveals significant crackles throughout the lung fields. Which action should the nurse take first? So I'm gonna get you guys 15 seconds. So read the question again if you can, and then read the choices carefully. Okay. So, time is up. Okay, so the correct answer here, y'all, is going to be positioning. And that would be the correct answer. Positioning the patient to a high Fowler's position and apply oxygen. Why is that the correct answer? Because that's the first nursing interventions that you would always do. Option number A is administration of an IV furosemide that's somewhat invasive in a sense that you need an order for that. And then you have to give the medication IV push. The other thing, letter B, is also incorrect because that is going to delay care. Because guess what? When you order, or when there is an order for BMP, the lab has to come in, the lab has to draw the blood, and it'll take a couple, sometimes hours, for you guys to get the BNP level. So that delays the care. And of course, letter D is also incorrect because similar to option B, it can delay care. You have to call somebody to do a 12-lead EKG, and then they have to print that, and they have to have somebody assess it for them, right? So of all the 4 choices, the best one that's easy for you to do, or that's quickly and fast, and at the same time nursing focus, is letter C. Okay, so let's go to question number 2. 68-year-old patient brought to the emergency department by spouse who states that the patient suddenly couldn't find the right words and noticed that their right arm was hanging limp. The patient's last known well time was 45 minutes ago. Which diagnostic test should the nurse anticipate being performed first? So that's the key word, to determine the appropriate treatment plan. 15 seconds. I need to see if I can put the sound on. There you go. So the correct answer is going to be a CT scan, letter C. I don't know if I can highlight that. Again, it will probably do it like this, right? So the correct answer is letter C. And so based on the stem, you know that the patient is having stroke, right? We don't know whether it's a ischemic stroke versus a hemorrhagic stroke. And how do you determine that? By getting a CT scan. So why is CT scan important? Because if you look at the stem, it says the last well-known time for this patient is 45 minutes ago. So if this is a ischemic stroke and you have 45 minutes, in a sense that the last time, you have enough time to initiate your TPA which is your thrombolytic therapy. So a lot of guidelines is saying that you can start it within 3 hours, and some evidence suggesting around 4.5 hours after the last time that the patient is feeling well. So if you chose letter C, and that would be the correct answer. Okay, so let's go to question number 3. A patient is admitted to the medical surgical unit with excruciating abdominal pain. The healthcare provider has scheduled an emergency endoscopy to identify the source of pain. Despite the severity of the symptom, the patient tells the nurse, "I've decided I don't want the procedure. I just want to go home." The question is, which ethical principle is the nurse upholding by respecting the patient's refusal to the procedure? So in your NCLEX right now, you're going to be seeing a lot of this non-clinical component, in a sense that these are not hands-on. These are more of ethics principles, nursing principles and stuff like that. Okay, so that's 15 seconds is up, and the correct answer is letter B, autonomy. We give, as always, the patient has the right to refuse any of his or her treatment, okay? And it's universal, okay? So question number 4, a nurse is admitted with 75-year-old patient who is suspected with community-acquired pneumonia. So these are community-acquired pneumonia, and potentially this is probably like a nursing home or somewhere. The patient is coughing frequently, and appears fatigued, but is currently alert and oriented. What is the priority safety intervention for the nurse should implement before providing the patient with their first dose of oral antibiotics? So remember, in this scenario, the patient has pneumonia, and it looks like they feel that an antibiotic is necessary. So the question is, what do you do first before you give that first dose of antibiotic? What's the best nursing action? I'm timing for 15 seconds. I don't know if 15 seconds is long enough. I don't know. Is that 15 seconds long enough? Let me get... Okay. So in this particular scenario, in the choices that you have, maintaining NPO is the best answer. So letter C is the correct answer. And the reason why, this is a 75-year-old and the patient has community-acquired pneumonia. We're not sure whether it's related to like an aspiration pneumonia, right? So to be sure that the patient is safe before taking the first dose of antibiotic, then maintaining NPO is the best option. Now, so I'm gonna put a what if. What if one of the choices is saying you need to get a blood culture first to determine what kind of antibiotic to give and stuff like that? So if that choice is there and letter C is still there, maintaining NPO, the best choice is still letter C, maintaining NPO. And the reason why, because the question is asking what is the priority safety intervention. The word safety intervention. It didn't just say what is the priority intervention. It says it's asking what is the safety priority intervention. So in that case, still it's going to be NPO. And the reason why it's still NPO, because we don't want aspiration pneumonia. Okay, so letter C is the correct answer here. Okay, question number 5. How's everybody doing? Oh, by the way, if you're new to this channel, if you could subscribe, I would appreciate it. I also create a lot of NCLEX cram guides and some help with tutorial session with a lot of nursing students. So feel free to check that in my bio. I'm gonna put that link in the description in this video. So, okay. While reviewing the telemetry monitor for a patient admitted with acute renal failure, the nurse notices that the T waves on the EKG has become tall and peaked with bigeminy. So you're already saying bigeminy. The patient's most recent laboratory results show a serum potassium of 6.2. Which medication should the nurse anticipate the provider will order to address these findings? So I'm actually increasing it to 20 seconds because I think 15 seconds is not long enough. But think about it. The patient has hyperkalemia of 6.2, right? But the patient is already having peak T wave at the same time by Gemini. So I don't know if you guys have seen a bigeminy. A bigeminy is like a PBC but occurring in every other beat. So that tells you that the cardiac muscle is already irritated. That tells you when the patient is having bigeminy or trigeminy, meaning to say two PBCs in every 3 beats. That's what it meant. If they're already seeing that, that just tells you that the cardiac muscle is very irritable. Now, all the choices here are correct, but the one that's going to protect the cardiac muscle will be letter D. So the correct answer here in question number 5 is letter D. And the reason why it's letter D, it's because you're saying in the stem of the question that the patient is already having peak T wave at the same time by Gemini, and the potassium is so high, so the cardiac muscle is already irritable. A is also a correct answer. B is also a correct answer. Of course, letter C is not a correct answer, right? But A and B are correct, but giving those are going to take longer for it to work. And it's not going to really protect the cardiac muscle. A and B is going to push the potassium back into the cell, whereas D is going to protect the cardiac muscle. And just the reason why that's the correct answer because of the word bigeminy in the stem. Okay, let's go to question number 6. So question number 6. A nurse is caring for a patient with type 1 diabetes who reports feeling shaky and hungry shortly before lunch. The nurse observes that the patient is diaphoretic and has a slight tremor. After verifying a blood glucose of 58, which intervention should the nurse implement first? I'm going to let you guys read the choices. So this is the type 1 diabetic. Just by looking at the stem, you're saying that the patient is already hypoglycemic with a blood sugar of 58. What would the first thing that you would do that would help with the clinical manifestations as well as the data in terms of the blood sugar of 58 milligrams per deciliter? What would be your answer? Okay. So the correct answer is letter C. Administer 15 grams of simple sugar such as a cup of skimmed milk. And the reason why that's the correct answer instead of letter D, because if you look at letter D, the hard candy in there is a chocolate candy. So remember, chocolate is high in lipids or in fats. That lipids or fats is gonna decrease the absorption of glucose. So that's the reason why D is incorrect. But the best answer here is letter C. Okay, so let's go to question 7. How's everybody doing? Again, if you're new to my channel, if you could subscribe. I'm doing a lot of in another platform, but I'm starting this channel. So if you could support and subscribe here, the better. I also create a lot of cram guides. So if you're in a process of taking your exam and you're kind of lost, I will put the cram guides and the sessions in the description of this video. Question number 7. A patient hospitalized with acute COPD exacerbation requires supplemental oxygen therapy to maintain an oxygen saturation of at least 90%. Which nursing action is priority 30 to 60 minutes after initiating the oxygen therapy? So I'm going to put the timer in. Again, read the question the second time around and then rephrase the question the way you like it and determine what is being asked in the particular question. Okay, so lock in your answer. Remember the question is asking, what is your action 30 to 60 minutes after initiating the oxygen therapy? So the correct answer here is going to be assess the patient for signs of CO2 retention. So letter B is the correct answer. And why is that? Well, remember, we know COPD patients and we know the idea of giving oxygenation decreases their breathing capacity. So that's what's happening really, because it's asking you, what is your priority 30 minutes to 60 minutes after you start the oxygen therapy? You don't want to just continue titrating your oxygen, right? You don't really want to reach as high as 100%, right? Because normally our CO2 patients, COPD patients are not going to breathe 100% 100% in terms of the O2 saturation. We can, like option C, the reason why it's incorrect, we can encourage them deep breathing and coughing exercises. But remember, we just started an oxygen therapy, so that's the main thing. And then letter D is also incorrect because, again, focusing on something that is really not related to respiratory, such as peripheral pulses, is not the best option. So letter B is the correct answer for question number 7. Okay, let's go to question number 8. A nurse is performing an assessment on a patient suspected of having stroke. The nurse notes that the patient has left-sided facial drooping, slurred speech, and weaker grip strength on the left side. Which action should the nurse take first to ensure patient safety? So again, read the question. We know that the patient has left-sided facial drooping. So the patient is having stroke in this clinical feature. Which action should the nurse take first to ensure, again, patient safety? That's the clue there. NCLEX is really focused on safety, so everybody knows that, right? So is it A, B, C, or D? The best answer here, y'all, is letter C. And the reason why, again, it's talking about safety. If the patient is already having slurred speech at the same time left-sided facial drooping, we're concerned about the swallowing ability of the patient, right? So initiating an MPO status until a swallow screening is performed is the best choice. So letter C is the correct answer. Why is letter A incorrect? Well, obtaining a detailed medical history regarding patient's cardiovascular risk, what is it going to do? We're not looking at the main issue right now. It's going to give us a history, but that's it. It's not going to tell us what is the most important pressing thing to do at this stage. Positioning the patient's head and neck in proper alignment to facilitate perfusion. The patient is already has a stroke. It's not going to reverse itself, right? And so letter B is potentially a correct answer, but it's not as best as letter C, which is initiating NPO status, because we're concerned about safety. Again, patient safety is the question, and we're concerned that the patient is going to have aspiration. And then letter D, educate the patient and family on the different types of ischemic stroke. First and foremost, Bruce 1 is ischemic stroke, and so incorrect information. Second, that's in the future. That's what's happening with the patient right now. So if you chose letter C, you are thinking correctly there. Question number 9. Okay, question number 9. A patient with history of gastric bypass surgery presents to the clinic reporting extreme fatigue and recent loss of balance. The nurse notes that the patient has pale skin and hemoglobin of 9.1. Which nutritional deficiency does the nurse suspect is causing these symptoms? So remember, this patient has gastric bypass surgery, and it's telling us that the patient has extreme fatigue and that the latest hemoglobin level is actually 9.1, which is significantly low for a post-op surgical patient. And the answer is vitamin, what do you think? B12 is the correct answer, right? When we're talking about gastric bypass surgery. Not K, not D, not calcium either. So the only vitamin that would resemble something that is related to anemia would be vitamin B12. And let's go to question number 10. Go to question number 10. So a patient is admitted with acute exacerbation of left-sided heart failure. The nurse reviews the patient's laboratory results and notes that the BNP level, which is the brain natriuretic peptide, is 1,500. Which physical assessment finding is most consistent with this laboratory finding? So read the question again and look at the stem. So a BNP level of 1500, is that normal? Is that low or is that high? And then the question is asking which findings, because it all reflects a left-sided heart failure, is most consistent with the laboratory value. So what did you guys choose? So the correct answer here is definitely going to be letter C. So why C is the correct answer? Well, it not only encompasses the left-sided heart failure, as you can see, crackles in the lungs, but also it encompasses everything related to a similar idea of weight gain. Now, the reason why letter A is incorrect because of the word dry mucous membrane in the other option. It says a weight gain or a weight loss is also not a good answer because patients who have exacerbated congestive heart failure may have to have weight gain, not weight loss. And then the dry mucous membrane is another thing that gives away that this is a wrong answer. So the best option out of the three is going to be letter C. Okay, so I was expecting only to record for 10 minutes, and now we're like 21 minutes. So I'm gonna stop in question number 10. I'm gonna record the remaining questions from 11 to 20 in another video. So again, I'm new on YouTube, and I'm the Nursing Student Avenger. I'm here to help nursing students succeed in nursing school at the same time pass their NCLEX. I have a couple of study guides that you could use. I will put that in the description on this video. Thank you for watching.